TNCRadio.LIVE, your commercial driver navigation station.
Good afternoon. This is TNCRadio.LIVE, and this is the Truckers Network Radio Show with your host, Shelley Johnson.
Thank you, Tim. I appreciate that. Yes, we are the Truckers Network Radio Show on TNCRadio.LIVE. We're all about the news, talk, information, entertainment, and music that drivers want to hear. You know, sleep is so important for us to feel our best, have the energy to get through the day. It's an essential part of the healing process of the body, too. But it's also one of the biggest challenges for many drivers who have to sleep irregular hours that can change all the time. Today, we have the honor of speaking with Dr. Michael Breus, the sleep doctor. He's considered one of the 10 most influential people in sleep, is on the clinical advisory board of the Dr. Oz Show, and is one of only 168 psychologists in the world to pass the Sleep Medical Specialty board without going to med school. Wow, that's incredible. The sleep doctor's been featured on many network shows, including Oprah and Rachel Ray. Welcome, Dr. Michael Breus. We're so happy to have you on the show.
Oh, thanks, Shelley. I'm excited to be here.
Could you tell us, our listeners are commercial drivers and truckers who keep really weird hours.
Yep.
How do they get a good night's sleep or enough sleep?
So first of all, there's nothing easy about driving a rig. That's number one. I've worked in and around the trucking industry in many different ways because I feel like this is a very unique population, which has some unique sleep challenges, to be fair. I mean, number one is you're on the road all the time, and in many cases, you're sleeping in the sleeper inside your cab. And so there's pros and cons to that whole environment, number one. Number two, the hours are going to be strange hours for a lot of people because, of course, they want to drive through major metropolitan areas when there's not traffic, and that's usually in the middle of the night. And many truckers also have a certain number of hours in which they're only allowed to drive. And so traffic can be a problem there as well. And also then people are rarely sleeping in their own beds. And so re-entry into the home environment becomes an entirely different process. So there's a whole host of different issues that we see for truckers for sure.
Are they resetting their clocks all the time? Is that part of the problem?
Well, you know, here's the truth of the matter is that unfortunately, unless you're passing through multiple time zones, it's kind of hard to consider yourself having jet lag if you're, riding in a rig. Now, if you're in an airplane where you're going 450 miles an hour, then yeah, sure, there's a likelihood of that. So I would say that there's less of a likelihood of truckers being out of shift in terms of sleep times and things like that if they're crossing over time zones. But what I would say is that the monotony of the road can certainly give people fatigue. I've spoken with many truckers who have told me that during their travels, unfortunately, many times their nutrition isn't quite where they want it to be. And so we're talking about weight gain, which can lead to things like snoring, sleep apnea, things like that. So the lifestyle for sure is something that affects our sleep. I'm not convinced, though, that traveling across time zones has a lot to do with it for these guys and gals.
Okay. I know a lot of them drink coffee. They have a lot of stimulants that just to stay awake.
Right.
Is that a problem? Should they maybe cut back before they're going to be taking time off to get some sleep?
So the answer to your question is a resounding yes. So, you know, one of the things that I can tell you. Well, wait, hold on. Can you repeat that question one more time? I'm sorry, I got distracted for a second.
Should they basically cut back on the caffeine?
Stimulants. Yes.
Stimulants and that sort of thing.
Yes, of course. I apologize. My son just texted me, "Welcome to COVID."
Yes.
So, I got a little distracted there. Yes, of course, stimulants. And so, look, I understand the level of alertness that is required to drive an 18-wheeler. I've ridden in them. I've spoken with drivers. I know and understand that. Do I understand that you need to be alert at all times? You bet. Here's the problem is when you take an external alerting agent, caffeine is one. There are a whole host of them that are out there. This will absolutely positively have an effect on your sleep. It needs to get out of your system in order for you to get good quality sleep. Now, there's going to be some people out there who are going to be like, what is this guy talking about? I drink coffee all day long. I crawl to the back of my truck when I'm exhausted and I fall asleep just fine. It's not the quantity of sleep that I believe that caffeine has the largest effect on, or these stimulants have the largest effect on. It's the quality of the sleep that you're seeing here. And so what ends up happening when you have stimulants on board, quite honestly, is you don't get into deep sleep and you rarely get into REM sleep. Now, remember, deep sleep, or what we call stages 3 and 4, this is your physical restoration. There are two things that prevent you from getting into deep sleep. One is alcohol, the other is caffeine. And so when I'm talking with people all the time, especially people who are avid caffeine users, I'm oftentimes talking with them about slowing down the caffeine consumption or switching over to decaffeinated in the latter part of the day. My general recommendation is to stop caffeine by 2 p.m. Now, I'm sure I just got a bunch of eye rolls from a lot of people saying, what, are you kidding me? That's when I'm having my third cup. Right. And so I can understand and appreciate that. That is in conjunction with the idea that most people are going to bed around 10 o'clock. So for folks out there who to have the real information, it takes between 6 and 8 hours for only half of the caffeine to leave your system.
Wow.
That is about the amount that's good for going to sleep with. Like, if you got to have caffeine on board, I'd probably rather you have half of it than all of it. And so this is where this idea comes from. Stop at 2, 8 hours later, roughly half is out of your system, makes it much easier to sleep. The same holds true for any other stimulant that we're talking about. And so whether it's a legal stimulant or an illegal stimulant, understanding the half-life of the substance will teach you when you need to stop using that substance in order to get some form of better sleep. In addition, when we talk about illegal substances that keep people awake, those have a tendency to be significantly more powerful, significantly less pure, and significantly more unpredictable.
Doc, let me ask you about that in particular, and not illegal so much as I don't know if you've been in a lot of truck stops, but when you're checking out at the truck stop, there's all
kinds of pills and packages by the register. Yes.
So I tried one once. Okay, I thought I was going to die. I mean, my heart was beating. I was sweating. I was like, "What have I done to myself?"
I'm glad you brought this up, Tom. I'm glad you brought this up. I want to talk about this. And so when you see these little packets at the convenience area in the truck stops, so generally speaking, they are loaded with caffeine. Now, many of them have decided to stop using caffeine, but now, Tom, they're using something called guarana, Guarana.
Yes. That's what it was. Yeah.
This stuff will knock you down, brother. I mean, or actually, rather, it will zoom you to the moon, if you will. It's like 3 to 4 times as powerful as normal caffeine, and it comes in a natural form. And here's the thing, is because it's called guarana, it doesn't have to be listed as caffeine on the label. And so many times we see it in the, quote, proprietary blend of herbs, and alerting herbs is what they sometimes call it. And I'll tell you something, if you have a heart condition, if you have high blood pressure and you take one of those things, you may have yourself a big problem on your hands.
What is that substance?
It's a naturally grown substance. It's a naturally alerting substance. Believe it or not, the guarana plant is found in many parts of the world. And we discovered it because so many people were just chewing on the leaves to give themselves the feeling, much the same way we see poppy fields, where you see where it's illegal and people are growing poppy for heroin, you see them eating the leaves all the time. The same held true with the guarana plant, but it was more for energy. And so this, of course, got translated across, and people were like, oh, I don't have to, deal with the FDA, and they can throw it in there that way. So once again, please, buyer beware. Also, you don't ever really know what some of those substances are or the purity of said substances. If you're going to use a stimulant, just use caffeine, right? Just have a cup of coffee.
Right.
I've studied that a lot.
Yeah. I mean, that if I could go to every truck stop and just pull those things down, I would. They're just not. It wasn't.
They're
good.
Not healthy, honestly. Yeah. And to be fair, I think that they are elusive to people because they think, well, if I can just take this, or I can do a shot. They've got the little the liquid shots, of energy shots and things of that nature.
I do that sometimes.
Once again. be careful. If you're going out and you're doing a road trip and you're going to take the family skiing and you want to do a shot, I don't think I care. But if your job, if your career is dependent upon you having energy and you're requiring yourself to drink these drinks, I have to be honest with you. This is not healthy behavior. It's certainly not going to be good for your sleep, and it's going to have some pretty long-term effects for sure.
And you're talking about things like Red Bull, and there's a trillion of them out there now. They all have different names. They all taste cough syrup.
But to be fair, Tom, there are some healthy energy drinks out there, right? One of them's called water. Right? It would be great if more people drank that one for a change.
Yes, of course. Yeah.
Absolutely.
Hydration is a good one. Also, to be fair, there's nothing wrong with coffee or tea, just not in excess. One of the things that I find a lot of people do, at least in the trucking universe, and this has been my personal experience, I don't have any data to back this up, is that it feels as though there's almost an immunity to caffeine, which seems to develop very early on in this person's career, where they can literally be downing caffeine all day long and they barely feel it.
Yeah.
And so
that'd be me. I drink a lot of coffee.
I can drink a cup of coffee and lay down and take a nap. So yeah.
I know, but remember something, Tom. If you do that, the quality of the sleep that you are getting is crap.
Yeah,
okay?
No doubt.
It's terrible.
Yeah.
Really, you want, again, the most natural way that you can sleep is always going to be the best. Which brings us to the idea of alcohol a little bit.
Okay, well, so let's hold there for just a minute. We're coming up to a break. Shelley, you want to take us out? We'll
sure.
Get back in just a minute.
You're listening to the Truckers Network radio show. We're talking with Dr. Michael Breus, the sleep doctor, on TNCRadio.LIVE. Definitely stay tuned for more coming up. Dr. Breus, you've got so much information here. What is the best beverage to consume that doesn't interfere with sleep?
Water would probably be the only beverage I know of that you can consume that actually helps with sleep. One of the beverages that I was mentioning just before we hit the break was alcohol. Because a lot of people are taking stimulants during the day to keep them awake, and then they sit there at night and they're kind of staring at the ceiling and they say, oh gosh, well, maybe I'll just do something to relax myself a little bit. And lo and behold, they'd start drinking a beer or some wine or a spirit or something along those lines. And it helps them relax and then fall asleep. And so many people think, oh, okay, well, I can have stimulants during the day and depressants at night. Right. Nothing could be further from the truth in terms of what's good for you and healthy for you. Now, let me be clear. I like bourbon. I like scotch. So I don't think it's terrible to have alcohol. But what I'm not thrilled about is having it too close to bedtime. The data has become somewhat consistent in that when you finish your alcohol, the time period between that point and lights out is really the most important time. So if you had one alcoholic beverage, my recommendation is to drink 1 glass of water and to wait 1 hour before bed. If you have 2 alcoholic beverages, you drink 2 glasses of water and wait 2 hours before bed. As an overall guideline, I tell people stop drinking roughly 3 hours before bed, which will give you 2.5 drinks or so. Now, some people out there might be saying, why do I have to stop at 2.5 drinks? Once you get past 2.5 drinks in terms of putting alcohol into the system, it's very difficult to have reasonably good sleep. So the amount and the timing is really kind of where we're at. So if you're cool with having 1 or 2 glasses of wine or beers with your dinner, and then being able to go to sleep, obviously, hopefully you're not driving, then you should be just fine. But generally speaking, we do not like to have alcohol too close to bedtime because there's a really big difference between going to sleep and passing out.
When you're passing out after drinking too much, is that even good? You get any kind of benefit from the sleep at all?
Almost none. It's as though you were anesthetizing yourself. So the way I tell people, it's like if we stuck a needle in your arm and you went to sleep and then you woke back up, how good of a sleep would you have had? Probably pretty terrible. So it's different because it's not actually sleep. Even though our eyes are closed and we're unconscious, we're actually anesthetized with alcohol, not sleeping.
Well, I know this is way off topic, but isn't that the whole crime around the Michael Jackson thing that The doctor was telling him he was asleep?
I was brought in on that. Yeah. So I was actually brought in to talk about that case. I talked about it on the Joy Behar show, as a matter of fact. And so one of the things that we saw in the Michael Jackson case in particular, he was given a substance called propofol, which is also known as the milk of amnesia.
Right.
It's an anesthetic. This is something that's used by anesthesiologists and veterinarians alone.
Wow.
Why Conrad Murray thought it was a good idea to give it to a human, number one. Number two, to a human who was as thin-framed as Michael Jackson was. While he was a lot of muscle, he was a lean, small individual. And so the dosage that was given looked, to my eye, to be something that could be very controversial. And then the guy walks outside and starts taking calls with his girlfriend and doesn't even monitor his patient. Honestly, I would consider it to be one of the greatest tragedies of all time, what happened to Michael Jackson. I mean, whether you like his music or not, pound for pound, he was an amazing entertainer.
Amazing.
Absolutely.
But this highlights, I think, one of the aspects that we've been talking about, which is the desperation that people feel when they're not getting a good night's sleep. I have many celebrity clients and athletes and all of these kinds of people. And you know what? They don't sleep well. Everybody else doesn't sleep well either. Guys, we're in the middle of a freaking pandemic, right? I'm sure everybody is aware of that. But what people aren't thinking about is how does the pandemic affect our ability to fall and stay asleep? So I'm here to tell you that this is a stressful situation like none other. And it's really weighing heavy on many, many people's minds. And so I would argue that now is the time where most people are going to be having difficulty falling asleep. Hopefully, they're not reaching for the alcohol to help them sleep or reaching for the caffeine to wake them up during the day, but rather looking for some more healthy and behavioral ways to get a good night's rest.
So when people go to sleep, quite often their minds keep racing, which I'm sure a lot of people are having that with the stress. How do they clear their minds? I would imagine stimulants don't help that.
No, as a matter of fact, stimulants would do the opposite. It would make it much, much worse. So what I tell people all the time is you don't have to take something to go to sleep, right? Your mind is far more powerful than any sleep aid would ever be. And so the goal here is to distract your brain in ways that you can. So there are multiple ways to do this. One of my favorite, this is going to sound very silly, but it really works, is counting backwards from 300 by threes. Now you're thinking, oh my God, this guy has lost it, right? So here's the thing. Counting backwards is easy, generally speaking, if you do it by ones or twos, but by threes requires some mathematical calculation. It is so mathematically complicated, you cannot think about what it is that is bothering you. I have very few people who have ever made it from 300 down to 0.
Interesting.
Another technique that I often use with many of my patients is called 4-7-8 breathing. So this was a technique that was developed by the Navy SEALs, and it helps you lower your heart rate. If people get one thing from my talk today, in order to enter into a state of unconsciousness, your heart rate, generally speaking, needs to be at 60 or below. This 4-7-8 breathing method helps your heart rate get there very, very quickly. So one of the other things I recommend to people is if you wake up and can't go back to sleep, this might be a thing to do, or if you're having difficulty falling asleep. The third thing is honestly consistency. The consistency in which your body knows when to sleep will increase not only your ability to fall asleep, but the quality of the sleep that you are getting. So if you can, going to bed or at least waking up at the exact same time every single day really should be a priority, because it will 100% allow you to be able to get a better night's rest.
Of course, with drivers, that's kind of hard to do. But
yes.
The counting techniques sound good. Could you explain the technique that you said that the Navy SEALs came up with?
Yeah, I lost that too.
Oh, so I'm sorry. So that's the 4-7-8 breathing. So you breathe in really deeply for a count of 4.
Oh, okay.
You hold it for a count of 7, and you breathe out for a count of 8.
Got it.
So people might wonder, okay, Michael, why should we do all this? So the big deep breath in is to really fill the lungs with oxygen. Now, many people don't know this, but carbon dioxide weighs a little bit more than oxygen does. And so when we breathe out and we don't have a really deep breath out, what ends up happening is the carbon dioxide stays in our lungs and we have what's called shallow breathing, right? So when we take this big, deep breath in, we expand our lungs, fill them up, and then we hold it to be able to utilize the oxygen. At about a count of 7, then we start to breathe out, and we breathe out longer. Notice the count of 8 when we breathe out. This helps us get rid of all that excess carbon dioxide that's been sitting deep in our lungs, and we bring in fresh oxygen. This is the mechanism by which our heart rate drops almost immediately, because when we have more oxygen in our system, our body's heart doesn't have to beat as fast to deliver it. It has to beat faster when we don't have as much oxygen. So deep breathing actually slows heart rate.
Interesting. So this would be something that maybe drivers could do after they
hopefully not while driving.
No.
But absolutely in their sleeper or in the back of their cab, 100% you could do something like this back there, and it would be very effective.
You had mentioned sleep apnea and weight gain can present problems for getting a good night's sleep too.
So one of the things that we know is the lifestyle by which many drivers lead is they're driving and sitting for most of the day. They don't get a chance to be as active as they'd like to be. And quite honestly, I don't think I've ever met a trucker who said that they lost weight while going on the road. So when we talk about a reasonably sedentary lifestyle in terms of the job, and unfortunately, it's hard to get really healthy food when you're out there, weight gain, unfortunately, becomes almost inevitable. When we start to gain weight, there's another issue that comes about, which is something called obstructive sleep apnea. So the first sign is the snoring kind of kicks in. Now, if you're riding in your cab by yourself and you're sleeping by yourself, then the snoring probably isn't going to bother you so much. But if you do have the opportunity to have a bed partner, or when you get back home and you have a bed partner and you're starting to snore pretty loudly, that can be an early sign of sleep apnea. The secondary signs are things like morning time exhaustion, people noticing that you're stopping breathing in your sleep, depression, waking up with a headache, things of that nature. But if you wake up after 6 or 7 hours of sleep and somebody next to you says that you snored and you don't feel so hot, there's a reasonable shot that you could have sleep apnea. So, okay, Michael, what is sleep apnea? Sleep apnea is where your throat collapses onto itself and you stop breathing in your sleep. This is an incredibly dangerous situation, and it can occur hundreds of times in a night. So for folks out there, if you think you may have sleep apnea, it's certainly something to talk with your doctor about.
On that note, we have to go to break. Definitely want to cover more information here with Dr. Michael Breus, the sleep doctor, on TNCRadio.LIVE. You're listening to the Truckers Network Radio Show. This is the Truckers Network Radio Show on TNCRadio.LIVE. I'm Shelley Johnson with Tom Kelly. Today we're talking with Dr. Michael Breus, the sleep doctor. Dr. Breus, before we went to break, you were talking about sleep apnea and what people need to look for. How serious is sleep apnea, but beyond not getting a good night's sleep?
So, it's pretty amazing when you think about it. Unfortunately, we think that almost 20%, 20% of men in the United States may have undiagnosed sleep apnea. Believe it or not, that number gets even higher when we talk about people who've got a few extra pounds on them, who consider themselves overweight, and even worse for people who consider themselves obese, or their doctor has told them that they are obese. And so looking at the long-term consequences of sleep apnea are actually kind of interesting, because it's one of those weird disorders where you wake up and you're like, all right, shake it off. I had a crappy night's sleep. I'm going to down a cup of coffee, get in my rig, and go. And you don't really think about it. You just kind of force your body to do it. Here's what ends up happening. So when you have a situation with sleep apnea where, let's say, you stop breathing, then your heart rate begins to slow down. It starts to slow down to conserve the oxygen in your system. And then your brain kicks in and says, holy crap, there's no air in here. And so it wakes you up to breathe. And so what happens is your heart rate speeds up and slows down, speeds up and slows down all night long. This puts an extra load on your heart and can cause an irregular heartbeat. This is when you really start to have a problem. So once you get to an irregular heartbeat, you end up with something called hypertension, which is high blood pressure, or something called refractory hypertension, which is high blood pressure that does not respond to medication. Now you're really in trouble, and you're looking at long-term, something called atrial fibrillation, heart attack, stroke, and death. Yes, that is exactly the path that you're going down if you have undiagnosed sleep apnea.
Wow.
I'm not joking. I'm not making it more than it is. This is kind of where it's at.
So can it actually cause hypertension?
Absolutely, it can.
Wow.
There's a lot of data to suggest that. So as an example, if you're driving and you're listening to us right now and you're on blood pressure medication and you think that you could be overweight and you snore and wake up with a headache in the morning, you could have a serious problem on your hands, something that you definitely want to talk with your doctor about.
Now, just because you snore, that doesn't necessarily mean it's sleep apnea, though, correct?
That's correct. I'm glad you said that, Shelley. Almost 50% of people snore, but only about 20% of people have sleep apnea. Interestingly, though, 100% of people who have sleep apnea actually snore. So it's kind of a two-way street, but the traffic is a little bit different on one side of the street than on the other, for sure.
Okay. Yeah, because I remember being concerned about that. I actually had a deviated septum I was born with, and I had it fixed. And the otolaryngologist or ear, nose, and throat guy said, you don't have sleep apnea. You just have always been a snorer. And you probably will continue to be that way because you never properly breathed when you were little. Is a conditioned response. So here's what I would tell you about that last part is I'm going to challenge that. Okay. I would argue, because I've worked with people with deviated septums, and there are now actually new tools that people can use that can actually be quite helpful. So here's something that's interesting. A brand new study, literally FDA approval 2 weeks ago for a new device called OSA Excite. So this stands for obstructive sleep apnea Excite. This is a mouth guard that you put in your mouth and it vibrates on your tongue, which causes your tongue to retract and stay retracted and helps with mild sleep apnea and snoring. So this is pretty fascinating because this is a treatment you could do during the daytime and then not have to use treatment at night. You know, many truckers are upset because they say, well, if I got sleep apnea, that means I'm going to have to wear that damn CPAP machine. And if I'm going to wear that CPAP machine, that's not particularly sexy. That's not particularly fun. And how am I going to hook that up in my cab? And, you know, it can be difficult. So this new device, OXA Excite, I'm very excited about it, simply because I think it's a great new innovation in sleep apnea treatment. Now, there are other treatments out there for sleep apnea. There are actually regular mouth guards that you would wear in the evenings that can be very effective for sleep apnea called oral appliance therapy. So I don't want anybody out there to think, okay, I snore, I must have sleep apnea, because that's not necessarily the case. But if you snore and you feel like crap during the day, then you may have sleep apnea, in which case, don't worry. It can be easily tested. Now we actually can test people at home or mobily, which is kind of nice. Oh, that is cool.
And it can be treated that way as well with either CPAP, with these devices. There's all kinds of new things out there. So I really want to impress upon everybody that's listening that sleep apnea is no longer a death sentence. Okay. Sleep apnea is something that can be treated. It should be identified and it should be treated. And you will find that you will live and lead a much happier life.
I had a question that had come in from a driver about the substandard mattresses that are quite often in the cabs and so forth.
Yep.
Is there a better type of mattress or pillow that drivers might want to look at so they can improve their sleep?
There's no question about it. The surface on which you sleep absolutely positively has an effect on you as a sleeper. I'm a runner, Shelley, and if I go and run a race, I can run a race with my flip-flops and my cutoffs and my torn t-shirt and a boombox on my shoulder. But to be fair, my time is just not going to be too good. But if I've got my running shoes on, my dry fit wear, and I've got some good tunes, I can run an 8-minute mile, no problem, right? Because my equipment is dictating my performance. I would argue that sleep is exactly the same way. If you have the right equipment, you will sleep better. Okay, Michael, that's great news. What is the right equipment? Unfortunately, I don't know a tremendous amount about mattresses that go inside of sleepers. I'm guessing that they are probably twins or twin extra longs.
Right.
But if you're looking for brands in particular, I personally think that the brand called Purple is a wonderful product. It has an amazing pressure relief category in it in terms of its abilities. Also helps remove heat quite nicely, which is another big factor, especially when you're in an enclosed environment like the back of a cab in a sleeper. And so I would tell people you might want to check out Purple. That could be a wonderful addition to your cab. And they make pillows, they make sheets, they make all kinds of different things. If you're looking at just getting a new pillow, there are a couple of different pillows out there that I like. One of them is by a company called Ever Pillow. That's the one that I use. It's called the Curve. I really enjoy it quite a bit. I think that is a good one. Also, there is a company that just specializes in pillows called Bed Gear, and you can take a pillow quiz online with them, and you can learn what kind of pillow would be good for you. So it can be personalized, which is what I really prefer.
What do you look for in a pillow? What should it do?
So I ask people 3 questions when we're thinking about a pillow, right? And so here's the funny thing. I don't know if you guys have ever done this. You ever go to like Bed Bath & Beyond, or like Bath and Body Works, so one of those places that sells pillows. So you walk in and there's like a wall of pillows, right? It like stretches to the ceiling. Every single one of them looks identical. And every time I go, it's so funny. I look around and I always catch somebody. And here's what they're doing. They grab the pillow, they push it to the side of their head, and they kind of push their head against it, thinking that that's some sort of a test. Okay? Shelley, have you ever done this?
Oh, yeah.
Exactly. So have I. It's ridiculous. We're asking the wrong questions at that point in time. There's 3 questions that we should be asking. Question number 1, squishy or firm? Squishy is an adaptable pillow. Firm is a memory foam pillow. You need to make that choice very early on. Which do you prefer? What do you like? Remember something, there's a lot of personal preference here, but also we have to be cognizant of the idea of head support. Remember, a pillow is kind of a bed for your head. So squishy or firm determines down, polyester, crushed filling versus a block of cheese, which is memory foam. The next question you want to ask yourself is, what is your starting sleep position? If you are starting on your back or on your stomach, then you would want a very thin pillow. If you're starting on your side, you need to make up for the space between your ear and the bed because you want your nose in line with the center of your chest. So understanding your starting sleep position is going to become very important. The final question you want to ask yourself is, do you have any upper shoulder or neck pain? If you do, then you may want to get a specialty pillow that is designed for that. And with those people who have upper neck and shoulder pain, I personally find that memory foam pillows seem to be a little bit better in terms of stability. Because
they have more support?
Exactly.
Mm-hmm. A lot of those are really hot, though. Is there a better
So
brand?
memory foam pillows are hot. That's one of the reasons, quite honestly, I like the Purple pillow and I like my Ever pillow. My Ever pillow is made of latex and a Kapok, so it's not as firm. But I got to tell you something, it is perfectly supportive, and it's got a zipper on the side, so I can take the filling in or out and raise or lower it to exactly my neck size and height, and that's one of the things I like most about it.
Having it customized is certainly something that's really important. And I know that a lot of drivers carry a lot of tension in their shoulders. And they develop neck pain and all of that over the years, I'm sure, because it's a lot of stress for driving.
You're making me stretch my neck right now.
Me too.
We're going to be going to break here and definitely talking about some more interesting things that our drivers need to know about. We're talking with Dr. Michael Breus on the Truckers Network radio show here on TNCRadio.LIVE. Definitely stay tuned. He's got some great information. This is the Truckers Network radio show on TNCRadio.LIVE. I'm Shelley Johnson with Tom Kelly. We're talking with Dr. Michael Breus, the sleep doctor. Dr. Breus, cabs can be really dry, and one of our drivers wanted me to ask this. How does that affect sleep?
You know, it's a great question, and it's something that a lot of people don't think about, so I'm really glad, Shelley, that you asked it for our driver out there. And so here's the deal. NASA actually started looking at environment, particularly air quality and humidity, because, you know, these guys and gals that are on the space station, that's something that they can control quite well up there, and that becomes a big issue for them. And what they discovered was, believe it or not, somewhere between a 30 and 40% humidity is really the best for sleep. Now, to be fair, we don't want it to be hot and humid. We actually want it to be cool and humid, which is not necessarily always the same thing to be able to do. The cooler the environment is, the better we have for sleep. And let me explain quickly why, in that our core body temperature and our sleep cycles follow one another. So as our body gets cooler, we fall into sleep. As our body gets warmer, we have a tendency to wake up. So once again, if you're looking at humidity in the cab, if you can get your humidity into the 35 to 40% range, it's going to help. Also, I actually recommend an air purifier. Remember, that's the fuel of your brain, and you're going to be breathing it in all night long. If there's dust, if there's particulates, if there's hair, if there's dead skin cells, all of those things that's wandering around in your vehicle, having a filter for air is going to be very, very important and an easy way to improve the quality of your sleep for sure.
Excellent. How do drivers and listeners get a hold of you, Dr. Breus? I know you have a website.
Absolutely. So actually, I have a podcast if people want to check it out. It's called Sleep Success with Dr. Michael Breus. It's available wherever podcasts are available. And people want to check out my website. It's The Sleep Doctor, and doctor is all spelled out, .com. I also own that on Facebook, Instagram, LinkedIn, you name it. We give tips and tricks on all of the different platforms. We give different ones on different platforms. So if folks out there want to check it out, you might want to check a couple of different ones. And I'm always interested in hearing from people. So feel free to send me your questions. You never know. I may answer them online during an Instagram live, or maybe even write a blog about it. So always welcome to hear from people at thesleepdoctor.com. And if you want to take a fun sleep quiz, go to chronoquiz.com.
Awesome. Thank you so much for being with us, Dr. Michael Breus. We've been talking with the Sleep Doctor here on TNCRadio.LIVE. Stay tuned for the Evening Surge coming up right here on TNCRadio.LIVE.
TNCRadio.LIVE, your commercial driver navigation station.
Hi, this is Tom Kelly, managing partner of IMSICO LLC, doing business as TNCRadio.LIVE. The website TNCRadio.LIVE and any content or podcast related to the website are copyrights of IMSICO LLC, copyright 2021. All rights reserved. Any redistribution or reproduction of all or any part of the contents in any form is prohibited other than the following. We welcome you to download and play the publicly available podcast and share with others for personal use. Please acknowledge TNCRadio.LIVE as the source of the material. You may not, except with our express written permission, distribute or commercially exploit the content. And while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind expressed or implied about the completeness, accuracy, reliability, suitability, or availability with respect to the website, the podcast, or the information, products, services, or related graphics contained on the website or podcast for any purpose. Any reliance you place on such information is therefore strictly at your own risk. For additional information, including details regarding monetization of this podcast, send email to podcasts@tncradio.live.